Right now, over 40 million Americans are taking statins every single day. Your doctor probably told you they're safe. But what they didn't tell you could be life-threatening. There's a condition called rhabdomyolysis that can literally destroy your muscles from the inside out. And that severe muscle pain you've been ignoring. It might be your body screaming for help. Today, I'm going to reveal 5 dangerous side effects of statins that could save your life if you know what to watch for. If you don't know what statins are, they're cholesterol-lowering drugs that millions of people take to prevent heart disease. Doctors prescribe them like candy because they work. But here's the problem: many doctors don't spend enough time explaining the serious risks that come with these medications. They focus on the benefits and brush over the dangers. That's why so many people end up in emergency rooms with symptoms they never saw coming. In the next few minutes, we'll cover 5 dangerous warning signs that your statin might be causing serious harm to your body, what these symptoms actually mean, and most importantly, when you need to get medical help immediately. Some of these signs require emergency care, and knowing the difference could literally save your life. Number 1. Rhabdomyolysis, the silent muscle killer. Imagine waking up one morning and your muscles are literally dissolving inside your body. That's exactly what happens with rhabdomyolysis. This isn't just muscle soreness from working out. This is your muscle tissue breaking down so fast that it releases toxic proteins into your bloodstream. These proteins head straight for your kidneys and can shut them down completely. The scary part? It starts silently. You might feel some muscle pain and think it's normal. But then your urine turns dark brown or color-colored. That's your muscles literally washing out of your body. Your legs feel like jelly. You can barely lift your arms. Some people describe it as feeling like their muscles are on fire from the inside. Here's the shocking truth: this condition can kill you within days if you don't get emergency treatment. The muscle proteins clog up your kidneys so badly that they stop working entirely. You need IV fluids, medications, and sometimes even dialysis to save your life. If you're taking statins and experience severe muscle pain with dark urine, don't wait. Call 911 immediately. Number 2. Severe muscle damage, myopathy. Now let's talk about something that affects way more people than rhabdomyolysis. It's called myopathy, and it's basically your muscles getting damaged from the inside out. This isn't the kind of muscle ache you get after lifting weights. This is persistent, nagging pain that doesn't go away no matter what you do. Your muscles feel weak. Climbing stairs becomes exhausting. Opening jars becomes impossible. The difference between normal muscle soreness and statin-induced myopathy is simple: normal soreness goes away after a few days. Myopathy doesn't. It gets worse. Here's what research has found that will shock you: most cases happen in men over 45 who already have health problems. But here's the kicker: women aren't immune either. The pain usually starts in your larger muscle groups. Your thighs, your shoulders, your back. It feels like a deep, constant ache that makes you feel like you're aging rapidly. Some people describe it as feeling like their muscles are made of concrete. The scary part is that many people just accept this as getting older. They don't realize their medication is slowly destroying their muscle tissue. If you've been on statins and your muscle pain has lasted more than a week, don't ignore it. Number 3. Liver damage. Your liver is like the ultimate filter for your body. It processes everything you eat, drink, and every medication you take. But statins can push your liver to its breaking point. Here's something most doctors don't tell you: statins force your liver to work overtime. They block an enzyme that your liver uses to make cholesterol. Sounds good, right? But your liver doesn't just stop there. It starts working harder and harder, trying to compensate. Over time, this can cause serious damage. The first warning sign is subtle. You might feel more tired than usual. But then things get serious fast. Your skin starts turning yellow. That's called jaundice, and it means your liver is failing. Your urine turns dark, almost orange. You might feel pain in your upper right abdomen where your liver sits. Some people ignore these signs, thinking they're just stressed or getting sick. But liver damage from statins can be permanent. Unlike muscle damage, which might recover when you stop the medication, liver damage can stick around forever. The really scary part: your liver doesn't have nerve endings, so it can be severely damaged before you feel any pain. That's why doctors are supposed to check your liver enzymes regularly. But many don't. Don't wait for symptoms, demand regular liver function tests. Number 4. Diabetes development. Here's an ironic twist that will make you angry. You're taking statins to prevent heart disease, but they might be giving you diabetes, which actually increases your risk of heart disease. It's like putting out a fire with gasoline. Researchers have found that statins can push your blood sugar levels higher and higher until you develop full-blown diabetes. This is especially dangerous if you're already overweight or have prediabetes. The statins act like the final straw that breaks your body's ability to control blood sugar. The early warning signs are sneaky. You start feeling thirsty all the time, no matter how much water you drink. You're running to the bathroom constantly. You feel exhausted, even after a full night's sleep. Your vision might get blurry. Some people notice they're getting infections more often, especially yeast infections. Here's the really scary part. Once you develop statin-induced diabetes, stopping the statin might not reverse it. You could be stuck with diabetes for life. And diabetes isn't just about blood sugar. It damages your kidneys, your eyes, your nerves, and yes, your heart. So you end up with the very problems you were trying to prevent. The cruel irony is that people with diabetes often get prescribed even higher doses of statins, creating a vicious cycle that destroys their health. Number 5. Memory loss and cognitive issues. Imagine walking into a room and completely forgetting why you went there. Or struggling to remember the name of someone you've known for years. Or feeling like your brain is wrapped in fog that never clears. This isn't normal aging. It could be your statin medication stealing your mind. The connection between statins and memory loss is something pharmaceutical companies tried to hide for years. But the evidence became too overwhelming to ignore. People reported feeling like their thinking was slower, their memory was failing, and their concentration was shot. Some described it as feeling like they had early-stage dementia. The scary part is how it creeps up on you. First, you might notice you're more forgetful than usual. Trouble finding the right words in conversations. You might lose your train of thought in the middle of sentences. Some people report feeling confused about things they used to know perfectly. One man described it as feeling like his brain was wrapped in cotton. A woman said she felt like she was thinking through molasses. The good news: unlike some other side effects, memory problems from statins often improve when you stop taking the medication. But here's the catch: some people never fully recover. Their brains seem permanently affected. And since many people don't connect their memory problems to their cholesterol medication, they suffer in silence, thinking they're just getting old. Let me give you the bottom line on when to panic and when to call your doctor. If you experience severe muscle pain with dark urine, that's a 911 emergency. Don't drive yourself, call an ambulance. If your skin or eyes turn yellow, that's also emergency room territory. Your liver might be failing. For other symptoms, here's your action plan. Muscle pain that lasts more than a week needs a doctor visit within days, not weeks. Unexplained fatigue, increased thirst, or frequent urination could signal diabetes developing. Get your blood sugar checked immediately. memory problems or confusion that interfere with daily life warrant stopping the statin and seeing your doctor urgently. Don't let any doctor brush off these symptoms as just getting older. These are real, documented side effects that can permanently damage your health. Remember, the goal is preventing heart disease, not trading it for diabetes, liver damage, or cognitive decline. Your health is worth more than any doctor's convenience in prescribing a quick fix. If this video just opened your eyes to dangers you never knew existed, you need to share it right now. Send this to anyone you know taking statins. It could literally save their life. Hit that subscribe button because I'm exposing more hidden medical dangers that doctors won't tell you about. And if this information helped you, smash that like button to help YouTube show this to more people who desperately need to see it. Remember, always talk to your healthcare provider before making any changes to your medications. But now you know the right questions to ask and the warning signs to watch for. Your health is in your hands.